want to turn now to our medical contributor, Dr. David Agus, who is joining us now from Los Angeles. Doctor, you had a chance to listen in there, and I'm wondering, first of all, what is your reaction to this news?
Well, first of all, I do think it's heroic that an individual talks about his medical care and demystifies it for the nation. Jimmy Carter said he had brain metastasis and liver metastasis from melanoma. So first there is a connection between genetic pancreatic cancer and melanoma. We know that from several other families that have genetic linkages between them. Second is the therapy he's receiving, called pembrolizumab, is a drug that was FDA approved about a year ago. And what it does is it takes the brake off the immune system. Cancer cells, particularly melanoma, have a don't eat me signal on their surface for the immune system. And this blocks it. So it's an antibody, a protein that's administered every 3 weeks. And in about 40 to 50% of people, there's a pretty dramatic response. That response can sometimes last for a year or two. It's very well tolerated. There are side effects because it unleashes your immune system, so on your thyroid and your GI system, but there is significant hope with this disease. Several years ago, there was almost no hope with metastatic melanoma.
We know the president is 90 years old, and given the family history of pancreatic cancer in his family, what do you think his prognosis looks like?
Well, I think that, several years ago, if he had been diagnosed with this, the prognosis would have been dismal, and we probably wouldn't have treated him at all. But in today's world, with this kind of immunotherapy he's getting, along with very targeted radiation therapy of the small lesions in the brain, his prognosis for the next year or two is actually somewhat optimistic, in that about half the people can live for a year or two with very little symptoms with this particular treatment.
You know, he mentioned the word melanoma, and for a lot of people, when they hear melanoma, they think skin cancer. Could you just explain, because as he pointed out, his own doctors told him that when you talk about melanoma, 98% of them are skin cancer cases. The other 2% can be internal cases, but that's not something that I'm sure a lot of people have heard.
Yeah, most, if not all, melanomas really are skin cancers. Many of the time you can find the original lesion in the skin it came from, but sometimes that lesion actually goes away, you can't find it. So those 2% of cases, while we can't find the original lesion, there probably was one originally. And so everybody needs to get a skin exam. Look at yourself in the mirror and look for changes. And if there are, ask your doctor about them. In general, melanoma is a preventable cancer from the death of it if we catch it early. And we catch it early by visually looking.
I want to ask you about the time frame of his surgery, because he was asked a question over the course of that news conference about why a little bit of a delay, essentially. We heard the president give some explanation for that, but can you just weigh in on the notion of not operating right away after they found that tumor on his liver?
So cancer grows at a pace. This cancer probably had been there for several years, and it takes a while till it's detectable, until you have symptoms. Waiting a month or two probably didn't affect his outcome at all. And again, it's a value system-based decision. He's a very smart individual, obviously, and he knew the chances, and he made his decision based on his values. I want to go on my book tour rather than having surgery right away, which would delay it. And it's his own decision, and we can't critique it yes or no. But I don't think it dramatically affected his outcome.
And Dr. Agus, you touched on this at the very top of your remarks there, but the notion of a former president of the United States getting up on stage and answering questions from reporters, detailed questions about his own treatment, what impact do you think that President Carter's news conference here might have for other people who are facing cancer?
I think it's tremendous. Sitting presidents have an obligation to talk about their health care. When Obama had a medical checkup this year, a 2-page report came out of it. But former presidents usually don't. President Reagan handwrote a letter about his diagnosis with Alzheimer's. And I think that transparency, that getting up there and showing your vulnerability, showing that he's taking this disease head on and showing that there's hope, is a really positive sign to cancer patients all across this country. And I think more people have to step up and say, I have cancer and I'm going to live with it rather than die from it.
And Dr. Agus, could you just also talk about some of the breakthroughs that have happened when you're talking about treating a cancer that appears in the brain? Where do things stand today in 2015 versus, say, just 5, 10, maybe 15 years ago?
It's a great question. So there are 2 aspects to his treatment in the brain. One is we can now surgically strike it with radiation. So he's going to get radiation that really targets these 4 millimeter lesions. then he's going to get a therapy that unleashes the immune system, which can also go to the brain and keep these lesions in check or potentially make them smaller. And so several years ago, especially this immune therapy, we just didn't have it. And melanoma was a death sentence. Now, hopefully, for a good fraction of patients, it's a life sentence. And this really is a dramatic change in therapy. For 100 years, we've tried to unleash the immune system on cancer, and now it's finally working.
All right. Important insight there from our Dr. David Agus in Los Angeles. Doctor, thank you so much.
Thank you.